Hello everyone, I'm Dr. Sabarupani, a general surgery resident, and today we have with us Dr. Harshita Mishra. Dr. Harshita has done her MBBS from St. G.S. Medical College and KEM Hospital, Mumbai. She completed her MD Respiratory Medicine from LTMMC, SION, Mumbai, and she's currently doing her senior residency in the same hospital in SION. Welcome, Dr. Harshita. It's great having you here.
Hi, Sabha. Thank you so much.
So, can you throw some light on what exactly is respiratory medicine and how is it as a branch?
Great. First of all, as a branch, I'm truly blessed that I'm a pulmonologist now. Respiratory medicine is, as the name goes, it is a branch which deals with your respiratory system. So it's your airways, and your lungs primarily. But there's a lot of critical care as well, which is involved in it, which is a little out of, let's say, the purview of only respiratory medicine. Um, the branch, I am currently very happy that I am a pulmonologist, and yeah, it's an upcoming branch, and not many people are quite aware of it. But it's a wonderful branch. Um, it's a very nice clinical branch. That's in a
Yeah, so
nutshell.
like you said, not many people are aware of it. And as undergrads, like during my undergraduation, I didn't have any exposure to pulmonology per se. It was only a part of medicine. But now, during my post graduation, when I have my co-PGs in pulmonology, I see that it is not just a small part of MD medicine, but it is a lot more. There is critical care, there are interventions, there's bronchoscopy and all of it as well.
Yeah.
So, how is your everyday routine like? What all is included apart from the OPD? What is different like?
Okay. So you are very right in saying that. In UG, we are really not quite exposed to pulmonary medicine. And especially in my UG college in KEM, we did have a posting of chest medicine, but I don't think people took it that seriously. Like, hardly, I think we would have gone for 1, 2 lectures, which is something that we shouldn't do because the faculty is really nice over there and they teach a lot of things. In PG, there was a completely different outlook towards that field. A lot of fields realize the importance of pulmonary medicine. My day, I'll tell you how it went. So morning, I used to reach at around 8 or so in the ICU. We used to have our ICU rounds. Then we used to have our ward rounds simultaneously going on. After that, we used to post rounds, just used to chill around, have a little lunch, go through all the patient files and see whatever the lecturer has said, whether you want to do anything extra for the patient. Um, Post lunch, we always used to have a nice PG activity in our, so either it could be a case presentation or journal club, PPT presentation, or some days we used to have our OPDs 2 days a week. And then later on by 4, where after the faculty goes, we go about with the patient workup, whatever is remaining. And it's not very light, but it's not some extremely heavy as well. The entire day you are occupied with work, and but you have a good night's rest. Yeah, so it's like that. Coming to what all is present, what all is encompassed in the field of pulmonary medicine. So, because I did my post graduation in an institute which has a lot of ICU load, we have our own intensive respiratory care unit, which is 12 bedded. It is the largest in government in Maharashtra, in Sion. So we'd had a lot of ICU work, patient critical care management, ventilatory management of the patients. There's a lot of critical care which you learn. Procedure wise, there are FNACs, pleural tapping, thoracocentesis, ICD insertions. Then you have interventional pulmonology, advanced ones like bronchoscopy, thoracoscopy, and some therapeutic procedures which are done bronchoscopically. Um, yeah, that's about it. And then you get to
That's
assist a few
great.
procedures. You get to see bronchial artery embolizations. You can also go and visit cardiovascular thoracic surgeries, and you can see their surgeries being performed. Yeah, so that's about it.
That is great. So I think for somebody who likes medicine and also likes the intervention part, it is a very good mixture of the two of it. And
Absolutely,
if
yeah.
yeah. And if I'm not wrong, I think there is a DM respiratory medicine after MD medicine. But now that this thing has come up and it is a separate niche in itself, it is a very good thing because it is decreasing our study duration. And I think we can directly take up MD respiratory medicine. If I'm not wrong, that will be a
Absolutely.
shorter path. And plus, you will directly be a pulmonologist instead of going through MD medicine.
Definitely. Yes, it is in a way an end branch that you take up MD pulmonary medicine, and then in some way or the other, the duration of studies is reduced compared to an MD general medicine. But now you have DM programs in pulmonary medicine even after you are done with your MD. So
Okay.
you do have, but it is not a compulsion. Matlab, you can still remain a very good pulmonologist if you do a little fellowships here and there after your MD, and you necessarily don't have to do a DM. So definitely the course is shorter compared to other general branches. And yeah, that is a great advantage in this
Great.
field.
Okay. And is there any difference between doing MD medicine and then doing DM respiratory later on, or directly choosing this path? Is there any difference between the two or no? Like
So
later on, when
I
we
am
come into
on
practice.
the Yeah, I have chosen the other path where I have directly gone into respiratory medicine. I would say all systems are connected in some way or the other. So it would be an advantage if someone has done MD medicine and then goes and does pulmonary medicine. So probably in the starting years, it might be a little advantage because you are well versed with your cardiology, you are well versed with your nephrology, and all these systems are quite connected with the respiratory medicine. But then over the years, when you are a specialist and you are practicing a specific branch only, even after you're done with your MD medicine, you do your DM, and then that branch, you're married to that particular branch, and then you practice that for the rest of your life. So I think over the years, I personally at this level, I don't feel it will make much of a difference. There is some slight difference, which is more apparent in the starting years, probably, but later on, it's all the same, is what
All
I
this.
feel and what my lecturers and all have told me.
Yeah, totally makes sense. I mean, you were very true about what exactly it is. And that degree is also DM respiratory medicine. And over here also, if you choose to do DM, it will be the same DM respiratory medicine,
The
nothing else.
same, absolutely the same. Yeah.
Okay, great, great. So how was life in KEM and SION? You have done your UG and PG both from very, very
Yes.
good reputed institutes of Maharashtra. So how was it? How,
I
like, was it very different in two places? Like, you have had the experience of both, so
I'm very blessed actually for that fact that I've done. It was quite quite parts of it were pure stroke of luck, I feel, and I'm very blessed that I was in KM and SION. KM was good, how undergraduate life should be. A little bit of studying and a lot of not studying.
fun.
So yeah, was involved in a lot of extracurricular activities, be it organizing fest, organizing confluence, or I was also the ladies welfare secretary, so we had a huge ladies common room renovation project in our tenure. So overall it was very good. Studies part was quite less in UG, I would say, but I think because you're so drained in 11th and 12th, you do deserve that time when you are studying and also doing other things for your overall development. So that it helped me. UG helped me a lot in gaining confidence in being able to sit in front of people and being able to confidently express myself. I think UG helps you a lot in that. So that was what UG was. Then I took a year off where I had studied for my post graduation exams. And PG, definitely, as a lot of pulmonologists will say that their first choice while PG would be MD medicine, and they sort of take pulmonary medicine as a trade off because it is quite similar to medicine only, with a lot of intervention in it. So it was the same for me, but retrospectively, it was a very good decision that I had taken, that I chose MD pulmonary medicine. And my college, LTMGH and SION, is probably, if not the best, it is one of the best for this branch. My program is really nice. My HOD is also amazing. He's a very good mentor. So it was good. It was a good mix of um, some days were a little hectic where you are like really overburdened, but that goes with every residency everywhere. But otherwise,
Makes sense.
overall, it was very nice. Because my faculty was absolutely non-toxic, so it was amazing. Amazing, yeah. Amazing is the word for it. Yeah,
That is great. I think you had a very good experience in both the colleges.
yeah.
Going back, you said about you being a part of the organizing team in Confluence. Back there in UG days, I had come from IGMC for Confluence in I think 2016 or 17. Now that I
Oh,
remember,
great,
come to KM. Maybe I must
great,
have
great.
seen it, but yeah, like
Maybe,
I didn't.
yeah. Definitely, we must have met each other. So,
And one more thing I wanted to ask is there a DNB option as well for pulmonology yet, or there is
yeah,
only MD
there is
there as
DNB option, definitely. In a lot of private hospitals in Mumbai as well, be it Hinduja, be it Bombay Hospital, they have very nice DNB programs. Their program directors are also very nice. So,
very
I don't think it makes a lot of difference now, MD DNB. Anything is good as long as your institute is good.
exactly. And I think once you come out in the market, whether MD or DNB, as of now, there is no much of a
Oh,
difference, right?
see, the patient never looks at what is there under your name. Never. They only care about your clinical skills. And that clinical skills you develop once you have done whatever degree in whatever branch, wherever, it should be a good institute for that particular branch. And that gives you your clinical skills. And that is what is required at the end of the day.
So summing up, I think you've really put forward everything very well. And for those who like medicine as well as intervention, this is a very good branch. And having said that, for a country like India, where TB is a very big burden, to summarize, I think the branch has a very, very bright future and we can do a lot for the country as well, is what I feel. On an ending note, do you have a message for anybody who is aspiring to take up the branch? Anything you want to tell them?
Yeah. Um, what I would like to advise, a lot of people don't take pulmonary medicine thinking that there's a lot of tuberculosis involved in it. And yeah, it's a big misconception that people have. There is tuberculosis involved in every branch if you're practicing in India, first of all. It is not limited to chest medicine. And even if there is tuberculosis involved, it is only a small part of the branch. The world of pulmonology is way beyond tuberculosis now in India as well. There are a lot of diseases. You'll get a lot of patients if you end up taking pulmonology, and if you end up practicing in private, you'll never have a dearth of patients. So if you feel that it's a branch probably, whether I'll get patients or not later on, there's no shortage of patients of pulmonology, especially after COVID-19. The demand of pulmonologists has increased a lot. That is just the business part of things. As a branch, as an academic interest, it's a very nice branch. It is actually equivalent to medicine only, and you get to practice a lot of medicine, but at the same time you get to do a lot of procedures, a lot of hands-on. um, Choosing your branch, I have always thought that choosing your branch is important, but choosing your institute also is extremely important. And if you end up doing pulmonology from a good institute like SION or KEM, um, or other private hospitals also, Bombay Hospital, Hinduja Hospital, um, short, you're going to have a really bright future. So that's there. And all the best to anyone who wants to take pulmonology. They can contact me, and I will just keep praising about the branch for another half an hour. I'm definitely sure. I'm so happy in this branch.
Great. Thank you so much. I think for somebody like me, though I am into residency now, but still for somebody like me or for other people who are aspiring and do not have a lot of knowledge about the branch, I think this was a very nice video which had included everything. You have very beautifully put up everything that a person would question before taking up the branch. And I'm sure it would help anybody who is wanting to take pulmonology and wants some clarity.
Definitely.
Thank you so much for
Thank you so
joining.
much for inviting. Bye bye.
Bye.
Take care. Bye.